Hey, you got hemorrhoids?
I do not have hemorrhoids, but they're really important. They're very, very common.
Okay, we're going to talk to you about the best way to deal with your hemorrhoids. Okay, but the one thing about hemorrhoids, if you shorten it to roids, it gets confusing.
Sure,
right?
especially in our viewers
Right?
too.
Because if I'm at the gym and I say, hey, anybody got roids? I'm sure to start a discussion about anabolic steroids.
I suspect.
However, if I'm playing shuffleboard at the Boca Vista Del Rey in Florida and I say, anybody got roids?
Sure.
It's a different conversation.
Yeah, that's a good point. That's a good point. But we need to find somebody, an expert on hemorrhoids.
Where are we going to find an expert on hemorrhoids at this hour?
Hey.
It's like really early.
Hey.
Dr. Callan,
Yeah.
expert on hemorrhoids.
Perfect timing.
Walking down the hall with a diagram.
What are the
About
odds of
hemorrhoids.
that? What are
We
the odds
didn't
of that?
stage that.
No. Okay, so let's start at the beginning like we always do. Welcome. Thanks for joining us.
Thanks for having
Dr.
me.
Callan, she is a general surgeon and expert in hemorrhoids. She's going to talk to us. Let's start at the beginning. What is a hemorrhoid?
So a hemorrhoid is like a pool of blood vessels that fills up with blood and can give you bleeding, pain, can stretch out the skin near the bum and make it create a lump or a little mass near the bum. So that's
And they
kind
can
of
only happen on the bum, like you can't get one on your face.
no.
That's a good thing.
So it's a swollen vein in your
suppose
perianal
you could.
area.
Yes, correct.
Okay.
Yeah.
Okay. So who gets them? Like, could anyone get them?
Anybody can get them.
Right, but
You can
usually
have
not
them,
children.
You can have them.
Uncommon in
have
children.
No, not common at all.
Right. So it's an age-related
Yes.
disease where the vein kind of slowly fails over time.
Yeah.
Okay.
Okay. Now.
Some of our behaviors, though, are what contribute to the formation.
And I suspect we're going to talk about that.
Yeah.
Okay, we'll get to the behaviors. But let's talk about the symptoms first. How do I know I have a hemorrhoid?
So the most common presentation is going to be pain.
Okay.
People will get, a lot of pain near their bum and bleeding. Bleeding and pain will be the most common ones. But you can also have hemorrhoids that will be painless. And there's just a difference in anatomical like in their anatomy in terms of if they have pain or no pain.
Okay, you heard it here first. Pain, bleeding, or maybe no pain and just the bleeding.
Is the pain all the time, or is it particularly activity-related pain, like one certain activity?
So it depends on the severity of the hemorrhoid. I think if the hemorrhoid is kind of in its beginning phases, it can be coming and going. But if it's really flared up and thrombosed, then you're going to have constant, awful, debilitating pain.
Okay.
All right, so I think I have a hemorrhoid. I don't, I'm just saying that for the purposes of this video. I think I have a hemorrhoid, so I'm gonna go see my doctor and I'll eventually get referred to a specialist like you, possibly.
Yeah, perhaps. I mean, you should have a workup depending on your symptoms and if you've had them before and what your age and.
So we always talk about that. That's the history. Your doctor will take a history and ask you some questions about, well, just like that. Have you had them before? How old are you? What are your symptoms? And then physical exam. What does the doctor look for on physical exam of someone who is presenting with possible hemorrhoids?
So on physical exam, if you have the painful, large, swollen hemorrhoid, you're going to see in the perianal skin a lump that's puffy, swollen. A lot of the pain comes from the puffiness and the swelling. If you have the veins that are actually clotted with blood, which is when they are thrombosed and very painful, then it might look purple. However, your examination may also be normal if you have these internal painless hemorrhoids that just bleed, because that's inside, and so you won't, unless you perform an anoscopy, you won't necessarily see in there.
So they would do inspection. Would a rectal examination be a routine part of this examination typically?
Yeah.
To make sure other more serious stuff is not there,
you want
like
to rule
cancer.
out. Correct. Yeah.
Okay.
Okay, and should people check for this at home? Can they check for this at home on their own with a mirror or something?
Yeah, I suppose. I mean, I love pictures because when I see a picture, I can really kind of understand what the patient is seeing. But I don't know if they should be doing their own rectal exams. They might not know what to feel for.
I think Dr. Callan's coffee table books looks a little different than mine.
And her selfies.
Yeah.
Okay.
Those are not my selfies.
So now you've had an examination, you've had some testing by your family doctor. They're highly suspicious that you have a hemorrhoid. That's bad enough that you feel like you need some type of treatment. Would they offer some treatment first, or would they go right to a surgeon?
So depends on where you are, but generally, let's say you come to see me. Okay. Let's say you've made it to me. I think Your initial treatment with your family physician will depend on your own personal history. But let's say, you haven't had a colonoscopy, because everyone should have one if they've had bleeding to make sure there's nothing else going on.
Right.
Then you would get sent to me.
Okay.
Or to a general surgeon. And then I always start with conservative management first. Because 95% of people will get better with good bowel regimen and certain supportive treatments.
So that's great news, right? 95% of the time, you will get rid of your hemorrhoids or make them better without a major intervention.
But it's not a quick fix.
Not a quick fix. That's
You
the
have
bad
to
news.
put in the time.
It's a good news, bad news thing.
So just like people that have trouble sleeping, we talk about sleep hygiene. You're going to talk about like bowel or bowel movement hygiene, essentially your strategy for bowel movement.
Yeah. So the key really there are two pieces that over time I have seen as the biggest things that improve these.
Okay.
The first thing is the fiber.
Okay.
I think we've talked about this in the past.
Yes.
I mean, I like the all brand buds just because they give a lot of fiber with a small volume.
Yep.
Kind of tasty, easy to mix with things.
Sure.
Yeah.
But you could have
And-
the liquid, you could have the
There's a
gummies.
lot.
There's lots of, and
Yeah,
as well
there's
as
so
there's
many
plants
things
that
now.
have fiber.
Oh, the fiber market is explosive.
So you want to have like 30. It is explosive.
Such
Actually-
low-hanging fruit, Paul's out though. Low-hanging fruit.
As
But we
talked
don't
about
want it to be
hemorrhoids.
explosive. We actually want it to be bulky.
Right. Okay.
Yeah. So you want to get about 30 to 40 grams of fiber per day, and most of us are just not getting that. And so why I always like the buds is because it throws in like it's a 10 grams in a small volume. It's easy to get people to be compliant with that.
Okay.
Right. What about the gummies? I've seen fiber gummies.
Yeah, so they're actually really fantastic, to be
Really?
honest. Yeah, they work really well.
A lot of them.
And so, yeah, any source. Like if you don't like, cereals, and then just find something that's going to give you that additional 10 grams of day.
Or like
per day.
every fruit and vegetable.
What?
Yeah, but you need a lot. So
Where do you get those?
You do. You should eat a lot of them. You should eat enough that you're fine. But again,
What are those
the standard American
most
diet.
people don't.
The standard American diet is certainly lacking in fiber. It's one of the big problems. This is why hemorrhoids are very common.
I mean, everyone
Because of
will
what
tell
we
me
eat.
I eat so healthy, and that's great, but you need more. And as we age, our motility slows, so
Sure.
you just have to add more as well.
Sorry, Dr. Broccoli.
No.
Okay, no, definitely we always say eat your fruits and vegetables, how important that is, but there are a lot of fiber supplements.
Throw in the fiber supplements.
Yeah.
Okay, so you tried the fiber, but you still have a hemorrhoid. What can I do while I'm waiting maybe to see my doctor or go to the merge?
Yeah, so you don't need to like right away have surgery. You can also try things like certain creams, and there are various, Preparation H have many concoctions that you can use.
Yes.
There are other creams that have witch hazel in them, and the witch hazel,
Halloween's close.
it's always near
It always-
Halloween.
Halloween.
Which hazel? Is that hocus pocus?
No,
or
so
does it really work?
It actually draws. So the pain you get from hemorrhoids is from the swelling that the hemorrhoid brings on a lot of fluid, and it creates a swelling and the stretching. And so the witch hazel draws the swelling out. And so things
They're
like
pads.
Tux pads
Yeah.
have witch hazel in them.
If anybody knows what witch hazel is, just tell us in the comments below.
There you go. So number one is more fiber. You said there's two.
So two, which is something that is like such a key piece, and I didn't mention this a few years back.
Right.
When we made a previous video that was
Yes.
very popular amongst
Yes.
our
Like
viewers.
this is so important, is not sitting for prolonged periods of time on the toilet.
Right.
It is like the worst thing you can do.
Make
for
your time
hemorrhoids.
in the bathroom more goal directed.
I say if you want to hide from your family, your kids, you want to watch a movie, you can do that in the bathroom. But
Keep the lid down.
wipe your bum, put the lid down, and sit.
Got it.
When you're sitting, you're actually separating and creating more pooling of blood in those
Right.
hemorrhoids.
Yeah.
The toilet's designed to allow things to fall out, right? So
Right.
and so that.
It just reminds me of that scene of Paul Rudd when he's in the bathroom playing Scrabble or whatever it is.
This
and
is
she's
40.
like, yeah. It's so funny.
Yeah, okay, so the design of the toilet is not one for sitting and hanging around.
Yes, no.
Get on the toilet, do your job, and
If
get
you
up.
can't, and if nothing's coming out in like 5 minutes, get up, move, walk away, go run, go do your normal things.
Okay.
It'll come when it comes.
And that's where that famous saying comes from. Or get off the pot,
Yeah.
Yeah. Like,
right?
Yeah.
It's
I should-
obvious.
have a big banner somewhere
Yeah,
about that.
put that sign in your washer.
Okay.
So
So
those
try
are
the
the two
non-operative stuff.
Fiber and don't waste your time sitting on the toilet if things aren't progressing.
Yeah.
And we're talking a couple months maybe. It might take for time to change.
So initially I would see people and then I'd say, okay, I'll see you in 4 weeks. And
Okay.
in 4 weeks, if your symptoms are better, we'll talk about other management strategies.
Okay.
So 95% of people are better.
Okay.
And then you have like 5% of people who are still having some symptoms.
Those are the people hanging on for the end of this video. So the 5%
Yeah.
tried the fiber, they've had pain, they've had bleeding. This is really frustrating for them. Can be limiting in your quality of life.
Yeah.
What are the options for them?
So depending on the type of hemorrhoid you
Okay.
have. So we have my diagram that I happen to just be holding today.
Yes.
So you have internal hemorrhoids and they're above this little, there's a little line where you have in your anal canal where you have sensation and no sensation. And so external hemorrhoids are where there's a lot of nerves. So these are painful because if you stretch the skin, and these, when you get a hemorrhoid, it's kind of like when you're pregnant. You stretch the skin, that skin's never going to come back to normal.
Sorry.
There's no way to get rid of that redundant skin. It irritates a lot of people. So a lot of people I'll see just because they're like, I have a hemorrhoid, and it's a prior hemorrhoid that is
Okay.
now left behind a skin tag. So those you can only cut them out. There's nothing you can do about those. We'll come back to like the acute hemorrhoid, but internal hemorrhoids, because they're above the area with the sensation, you can actually put an elastic band around them. Because by putting the elastic band, you're going to choke off the blood supply to the hemorrhoid. It'll create a scar, and that area with those veins will just collapse and kind of fall
And
off.
that's called banding. You've probably heard of that.
So for perspective, like how big is the hemorrhoid? When you're talking about putting a rubber band
Oh, they
on it.
vary in size, but we have this little tool that you can that sucks the hemorrhoid in, and then you click it and it deploys the elastic band at the
But
base.
it's probably in the realm of millimeters, not centimeters in diameter.
Some can be centimeters.
They can be multiple
They can
centimeters.
be pretty big, yeah.
Wow. Okay.
And the problem is if you fix one, there's more to come. So
Right.
you have to come back to your bowel regimen.
Because the blood
Otherwise,
gets shunted elsewhere and just another hemorrhoid comes.
yeah.
So it's not a quick fix. I mean, it's a quick fix, but in the sense that it has to be in addition to that lifestyle change
Right.
that you have to make that to stop what was causing the hemorrhoid in the first place.
Yeah.
Okay, so you ban the internal ones. You sometimes excise the external ones.
And then, so that's the skin tag part. Now, if you
Yep.
have an external hemorrhoid so typically we don't, like if you're acute and emerged, you got a thrombosed hemorrhoid, you can actually make a take the clot out. We don't often do that. So really the surgical ones get, it's if they're infected and,
Yep.
and there's pus. But if you're going to remove one of these, you can surgically remove it. It's a very painful surgery though.
Okay.
So I usually say prepare to be like out of commission for up to 4 to 6 weeks.
What does
It's
recovery
a
look
very
like for
painful
those
area.
people? So you can't sit probably on anything hard for a while.
Yeah, it's very painful.
Okay.
Yeah. So, and it varies by patient too. So some patients it's worse than others. So and I don't know how to predict who's going to
Yeah.
have more or less
We
pain.
never can. That happens in all lines of medicine.
Yeah.
Some people can get through, some people can't. So there, I mean, if you've got hemorrhoids, this is great news because 95% of the time we can make them better without an intervention.
Yep.
However, there are interventions that we can use if we have to. And the even more important news is if you don't have hemorrhoids, but you're kind of on the road to hemorrhoidville, stop now.
Yeah.
Exit, eat your
Get your
fruits and
fiber.
vegetables, get your fiber.
Don't sit on the toilet.
Don't sit on the toilet for too long because you don't want to get hemorrhoids because it can be a prolonged recovery course after.
Excellent advice.
And increase fiber as you age. Just know, as we age, our motility changes.
okay.
And a good measure if you're sitting on the toilet too long, if you turn on this video and you sit down to go and the first joke has come and you're not done yet, get off, okay? Because usually our first joke comes in around the time when you should be done your business on the toilet.
Yeah.
Okay.
Now you know. If you like this video, please like it, subscribe to our channel.
Dr. Callan, thank you so much for your expertise in this area and sharing it with us.
What a great coincidence that I was walking by.
It's perfect. And remember, you are in charge of your own health and your own hemorrhoids.
We'll see you next time.